Kidney cancer is among the most aggressive cancers. What can cause this type of cancer?
Okay, for kidney cancer, we know two potential reasons to develop a kidney cancer. One is smoking. If you smoke, you're a potential candidate. If you live in an area where people smoke, which means you're a passive smoker, again your risk to develop a kidney cancer is increased. And the second most common reason today is obesity. If your weight is higher than your acceptable but ideal body weight, then your risk to develop a kidney cancer is increased. It's not only developing kidney cancer. If you smoke or if you're obese, your treatment results are decreased once you get diagnosed with kidney cancer.
What are the possible symptoms of kidney cancer?
Today, we are lucky to not see these symptoms anymore, because today usually kidney tumors are diagnosed in the early stage, because today people get an abdominal ultrasound, abdominal CT or abdominal MRI for other reasons, and they are usually diagnosed as incidental tumors. But in the old days, and probably some patients are still today, come to our office with bleeding, which means hematuria, bleeding in their urine, and if they have an advanced disease, they even come to our office with the loss of weight, with in bad conditions, where we have to be more careful while evaluating these patients because they are usually metastatic patients.
So in general, what are the tests or imaging that need to be performed to diagnose kidney cancer?
Usually an ultrasound is the first imaging modality, and if there is a suspicious lesion on the ultrasound, we usually have to confirm this finding with either CT or MRI, as long as the creatinine level of the patient allows us to perform these images.
How fast can kidney cancer grow? What are the possible organs that it can metastasize to?
How fast it can grow is questionable. I cannot answer this question accordingly, because it depends on the patient's age, it depends on the location of these masses. It is close to the vascularity or not. But those organs where the kidney cancer usually metastasizes is the number one is lungs, and number two is bones, which are usually the vertebral bones. So these are the two most common locations.
What are the common treatment protocols for kidney cancers?
Okay, in kidney cancer, we are trying to operate the patient, surgical treatment, as long as the patient allows us, as long as the tumor allows us. So we all know, even in metastatic disease, if we can perform the surgery, then the results are increased. The success of our treatments is increased, where we cannot operate these patients. With systemic therapies, we can achieve a lot, but combining systemic treatment with a surgery results in better outcomes in patients with kidney cancer.
What can you recommend people to prevent this type of cancer? For example, does drinking a lot of water might affect it?
Okay, that's a common question we get about water and kidney cancer, about water and urologic cancers. Okay, we love patients to drink water, but unfortunately water cannot prevent people to develop kidney cancer. They have to stop smoking, and they have to achieve normal body weights if they want to decrease their risk of having kidney cancer. And all other measures are not effective in kidney cancer.
Thank you.